Okay, so there's a new variant of the COVID-19 that's going around. It's similar to a cold, but the symptoms are more severe. You have an overwhelming amount of fatigue that you just can't explain. Even if you slept for 10 hours, you still wake up completely fatigued and tired. Most people have been complaining of a sore throat, hoarse voice, an unproductive dry cough that seems to linger. They have a fever off and on, nauseated, completely no appetite, and the headaches are extreme. It almost feels like a migraine. So those are the symptoms of the new variant of COVID-19. So if you feel like you have COVID-19, please stay home, wear a mask in public, and make sure that you go see your doctor for some type of treatment and stay hydrated. It's extremely important that you stay hydrated. It's extremely important that you drink fluids. And if the doctor prescribes an antibiotic, it is extremely important that you complete the antibiotic. All right, so I will keep you updated as new information is available to me. Have a good day.
At this point, I don't know who to believe. I was watching the news last night. They came out and they was talking about the 10 child deaths and linking it to the vaccination.
COVID-19 cases are rising in the U.S. Centers for Disease Control and Prevention. In its latest report, the CDC said the number of cases is now growing in at least 26 states. Virginia and Washington, D.C. are on that list. COVID-related emergency room visits for young kids are also the highest they've been since March. Even though COVID may not be making headlines like it used to, that doesn't mean it's gone.
COVID is not just another common cold. It carries higher risks and should not be brushed off. The pandemic may be over, but there is a new COVID variant to be on the lookout for. NB181 gets its nickname razor blade throat from the severe sore throat it causes. The other COVID symptoms remain the same: cough, fever, shortness of breath, loss of taste or smell, fatigue, and more. Even a mild case can be disruptive to your life. So how can you protect yourself? Good hygiene still goes a long way. Cover your mouth when coughing or sneezing. Spend the extra 20 seconds to wash your hands well. Open windows to increase ventilation. And wear masks in crowded situations.
It did not provide details about the deaths or how the FDA came to that conclusion. The agency will now adopt a new approval process, including stricter requirements for vaccine use in pregnant women and trials for pneumonia vaccine.
Then you hear a doctor speak on it and he's saying, well, they're not giving any information. And you start thinking about it and you research into it and you see, well, they let go of a lot of staffing at the FDA. And what can we really truly believe? So I say, do your research on your own. Figure out what's best for you and your family when it comes to the, you know what, because the numbers are increasing. It is flu season, but the numbers are increasing for the C as well. And we need to protect ourselves as best we can. But can we trust the data that they're giving us? What exactly is in that? What is in that? Because it does cause effects. Not saying this caused the effect or the C itself caused the effect. Whatever the situation, people are ending up with heart conditions who didn't have heart conditions before. I know for a fact because I have a family member that ended up with a heart condition when they didn't have one before and had to actually get a stent. Why? Because her job forced her to get that, or you cannot work. So we're dealing with, control, and that was the start of it. If you think about it, that was the start of it. And step by step, they're increasing how much control they have over us. So do your own research, figure out what's best for your family, and we can agree to disagree. I mean, I don't know what to do. As far as I know, I have not gotten, after that first series, I never got any more. I just didn't feel right about it. But that's for my own
vaccines to 10 child deaths. Hey, I'm Dr. Coyce, emergency physician. Let's talk about it. This memo, written by an FDA official, hasn't been peer reviewed, doesn't share children's ages, medical histories, or how many doses were given, and appears to lean heavily on VAERS reports, which are great for spotting safety signals but cannot prove that a vaccine caused a death. Multiple big studies and tens of millions of people show myocarditis does happen after mRNA vaccines, but it's rare, a few cases per million doses.
It's around this time, around September, October, November. I see all my patients come into the pharmacy complaining on how to stop or prevent themselves from getting the flu, RSV, rhinovirus, or any upper respiratory illnesses. So I'm going to save you a trip to the pharmacy, do my recommendation on how to prevent all of this. My number one recommendation is a Nazamine iodine mist. This guy right here. This is a powerful antiseptic, basically hand sanitizer for your nasal cavities. Respiratory illnesses spread through your nose when you inhale it. Iodine paired with fulvic acid eliminates 99% of germs in about 90 seconds.
Have you ever noticed hospitals swab your nose before surgery? It's because your nose is a huge reservoir. They like to use iodine because it kills germs within 90 seconds of administration. So basically, it's a no-brainer. But imagine having a simpler solution to apply in the comforts of your own home. Triquetra. And get the same effect. This is Nazamine by Triquetra. It's basically a nasal iodine and it has fulvic acid as well. Listen, within 90 seconds of coming in contact with your nose, it kills all the germs off. No dripping, no burning, 1 to 2 pumps, and you're good to go. It's good for on the go, on habit forming. And like I said, the mixture of the iodine mixture with the fulvic acid is going to kill the germs within 90 seconds. Listen, if the hospitals make swabbing our nose a priority, shouldn't we care for our nose and our daily routine as well?
This is probably the best drug to get over the counter. If you have a sore throat or runny nose, this is probably the best drug to help with that. I've been a pharmacist for over 17 years and I know what I'm talking about. You're going to want to head over to the cough and cold section. And you're going to go past all these drugs right here that just have a ton of marketing. You're going to look down here, bottom. This is my go-to product, chlorpheniramine. So this will dry everything out from a runny nose to a sore throat. And typically what's happening with a sore throat, it's called postnasal drip. So instead of running forward out your nose, it's running down, causing you to have a sore throat. Chlorpheniramine is a antihistamine that will dry all that up. It's a very, very old drug, but super effective. One of the side effects is though, it'll make you sleepy, so be aware of that. 100 tablets for only $4.28. So literally this bottle will probably last you a couple of years. Nazamine iodine nasal spray kills 99% of germs in about 90 seconds. This is my number one recommendation to all my patients to help protect them from getting the ick. Let's dive in. Number one, if I'm allergic to shellfish, can I take this? Nazamine's iodine is actually made from a vegan source. Not to mention, since they pair it with fulvic acid, they don't have to use as much iodine in this formulation to get the benefits. Soy sauce on your sushi actually has more iodine. Number two, can kids use this? Iodine has actually been used across the world, especially in the younger population, down to about 2. Actually, a lot of NICUs use iodine to help their patients. Number 3, can I share my bottle of Nazamine with other people? Ew, no. Each person should have their own. And number 4, how many times a day should I use this? I do 2 sprays in each nostril, about 1 to 2 times a day. But if you know you're going to be in an area with a lot of sick people, like an airport, I do it up to 4 times a day.
So I'm in here now, and guess what I found? I found the allergy relief that he was talking about. So I'm about to grab a couple of these, one for me, one for my son, because he has really bad allergies. And there is the price. And while they do have the iodine, betadine in here, this is good for your first aid kit, don't get me wrong. But I am planning to purchase that neomycin. You do what's best for you. Protect yourself the best you can. One of the best things you can do for your family is to start a garden, get your seeds, figure out what you're going to grow, where you're going to grow it, how you're going to grow it, and get busy doing that. You don't have to have a garden bed. You can use buckets like you see the white buckets right there. Just do something, because relying on someone else is giving them control.
I was a girl with dreams so wide, eyes full of wonder, heart open, untied. The world seemed soft, a place to run through the days in the sun's warm sway. But somewhere along the road, I felt the shift. The days turn.
You have your finger.
Be like see the weight of the change rest on my chest. Question